This topic is about assisting a client to use a bedpan. Bedpans are receptacles that are used for urinary and fecal elimination when a client is not able to stand or sit to use either a bedside commode or the toilet. These clients include those who have been prescribed bed rest, for example, to treat premature labor, or those who have had a procedure performed that requires them to remain either supine or on bed rest, like fractures or skeletal traction. Depending on the client's condition, the nurse will select the appropriate type of bedpan. A regular bedpan can be used for most clients. It has a high, rounded, and smooth back, and the basin is about 2 inches deep. A smaller bedpan, also known as a slipper or fracture bedpan, is used for clients with spine or hip fractures and helps to prevent the excess movement needed to use a regular bedpan. These may also be a good option for other clients with limited mobility since they are lower and tend to be more comfortable. These bedpans are low and have a flat back that slides easily under the client, and the basin is about 1 inch deep. When a client needs to use a bedpan, first put on clean gloves and ensure the client's privacy. Next, place the client in a supine position. Roll the client onto their side facing away from the nurse. For clients with a spinal injury or who have had spinal surgery, it is especially important to maintain spinal alignment as you log roll them. Place the flat edge of the bedpan against the buttocks and hold the bedpan in place while the client rolls back into a supine position. For clients with unrestricted mobility, the client may choose to lay supine with their knees flexed and raise their hips to lift their buttocks. Then, we can place the bedpan under the client. Unless contraindicated, raise the head of the bed 30 to 45 degrees to provide the client a more natural position for urination and defecation. Pull the curtain or close the door to provide privacy and ensure the call system is within reach. Ask the client to activate the call signal when they are finished. Remove your gloves and perform hand hygiene before leaving the room. Remove the bedpan as soon as the client is finished. Pressure on the buttocks from the bedpan can lead to the development of pressure injuries. Put on a new pair of clean gloves and place the client in a supine position. The client can either lift their hips if they are able to, or we can roll the client onto their side while we hold the bedpan in place. If we fail to hold the bedpan, the contents might spill. Remove the bedpan and provide perineal care and replace the linens or gown if they have become soiled. Clean the bedpan immediately after each use. Remove the gloves and perform hand hygiene. And before we leave the room, we should make sure that the client is in a comfortable position with their call system within reach. When assisting a client to use a bedpan, avoid lifting the client to prevent muscle strain and injury. Check the client for any mobility restrictions, such as an inability to raise the hips, before selecting the type of bedpan to use. Remove the bedpan in a timely manner after defecation to prevent skin breakdown and the development of pressure injuries. And we should always ensure the call system is within reach before leaving the client's room.